we're going to look at some of the biggest ways seniors on Medicare can save money. We're going to cover different topics that we see every day that potentially can mean thousands of dollars in savings that most people with Medicare just don't know about. So let's walk through those in today's video and see if we can save you money with these points. Let's start with the first big cost that Medicare recipients are looking at, which is Part B. So Medicare is broken up into two parts. Part A, basically inpatient hospital. Part B is pretty much everything else. Doctor visits, labs, outpatient procedures, which can be expensive. Think cancer treatment, think outpatient surgery. Those can be $100,000 per year easily. So that's Part B. Now, Part A is free, usually, or zero premium. You've paid into it all your life for most people through payroll taxes or a spouse did. So you don't pay for that. Part B has a separate premium, a monthly premium that you have to pay to have it. You have to opt in for Part B. And a lot of people who sign up for Medicare don't know this is coming. So they may quote an Advantage plan and says zero premium. They're like, oh, great, I have zero amount I'm going to pay monthly. Then they get this bill, either monthly deduction from Social Security or quarterly if they don't take Social Security yet. And it's over $600 and they're like, whoa, what is this? I didn't budget for that. I didn't plan on it. That is Part B. Now, it's really important that we have Part B because if you don't, you're on the hook for all those outpatient costs. Again, we're not worried about the office visit. A lot of people are like, oh, I'm healthy. I don't go to the doctor that much. We're more concerned with outpatient surgery, ER, cancer treatment, the things that can quickly be thousands, tens of thousands, or hundreds of thousands of dollars per year. You don't want to be responsible for that. You need Part B to take care of that. So that premium, even though you're looking at it, it's over $200 a month for most people, it's nothing compared to the cost it's protecting against. Because remember, Medicare is picking up 80% of the bill. You're picking up 20%, and it's still expensive. So definitely make sure that you have your Part B. Is there anything we can do about that? Couple notes. Your Part B may be much more expensive than the average because they look back 2 years at your income. Let's say you were working 2 years ago, making a lot more money, you retire, you go on Medicare, and your income has dropped significantly back from 2 years ago. You can appeal if there's a IRMA or a penalty, not a penalty, but an increase in your Part B premium. You can appeal to bring that down based on your current situation if it's very different from 2 years ago. That's one way to address it. Otherwise, there are Advantage plans which will offset your Part B premium. They're called Part B give back plans. We can run those quotes for you if you really have to keep these costs down. But make sure Part B is in place. Let's look if there are ways to save there. Reach out to us and we can go through your situation. We looked at spending on Part A and B, traditional Medicare. A lot of people, most people out there, and this is a really important point, you should look at something to fill in the gaps for what Medicare doesn't cover. We're really concerned about the 20% because there's no cap to it. A lot of people out there go the Medicare supplement route. We'll talk about Advantage next. And when they look at that, they usually run a quote when they turn 65. They pick the cheapest plan or go with a plan that their friends told them about, and they never look back. They like how Medigap or Medicare supplements work. They can see their doctors, refer themselves out. It goes with them when they travel. And they don't want to ever lose that, so they never quote the market. This is a huge mistake. We see people every day who are on Medicare supplement plans that maybe they signed up with a year, 3, 5, 10 years ago, and they are way overpaying for that plan because the cheapest carrier for a given plan, let's say the G plan, at age 65 is rarely the cheapest at age 70 or even 75. It changes and adjusts as you get older, and they just stay on that plan, and they just keep paying because they like Medigap. At Medigap, the things they like has nothing to do with the carrier they have. It has to do with the Medicare supplement. And that's going to be the same. The benefits are standardized federally. So G plan's a G plan. The networks are identical. Any provider that accepts Medicare, Let us run the quotes for you to see if there are cheaper plans, both within your plan level, let's say G plan, or even down, like the N plan. And we still have a large percentage of the market that's on the old F plan. That means they're paying probably $600-700 more per year. And the only difference is the Part B deductible, which is just over $200. That's a slam dunk, meaning they can't come out worse by going from the F to the G. And we help people do this all the time. But more importantly, within carriers, the benefit and the rate difference can be significant. So we have to take a look at that and see if we can save money for you. Reach out to us if you have a Medicare supplement, either an old one, a brand new one, or if you're looking to enroll, so we can run quotes across all the major carriers. Around your birthday, you can change plans to the same level with no health questions. Super easy. It's called the birthday rule in California. Finally, Advantage plans. This is so tricky. It's so hard for the average person to really compare all the Advantage plans out there, especially if you're in an area like LA where there are dozens of plans to compare. How do we know we're getting the best value? This is tough. First of all, we have to weed out plans that probably won't be a good fit with what we call our triple threat kind of analysis. One, we have to look at star ratings. We want 4 or higher stars. That reflects how existing members, prior members, feel about the day-to-day of their plan. It doesn't make sense going with a quote-unquote cheaper plan if people aren't happy with it. You're going to feel that. This is healthcare after all. It needs to work. Then we need to look at the max out of pocket. It doesn't make sense to go with a plan that has a much higher max out of pocket, meaning we're going to pay more on the back end, even if it's given us all these kind of freebies up front and looks great up front, but we pay more on the back end. There are a couple of caveats there, and we'll talk about those, but we have to look at that piece as well. Finally, premium. In a given area, usually the premium is pretty comparable. For example, in LA, there are tons of plans with 0 premium. So then how do we compare that? A couple things. We need to put in our doctors. We need to put in our hospitals, make sure they work with the plans we're looking at if they're very important to us. Then we need to put in our medications and dosages because that will directly figure into the cost. And in the system we offer, which you can use free of use, no obligation, where you can run your quotes, you can actually put in your medications, dosages, and doctors, because then you can sort by total estimated cost. And it will show you, okay, based on your medications, this is your expected prescription costs over a year's time, including both the premium and or the out-of-pocket expense for those medications. Super important. That's a way to save. Then remember when we were talking about Part B before? Let's look at those Part B give back plans. If you're in pretty good health and you're in an area where they're going to contribute 100, 150, even more per month towards your Part B, we need to look at that because that's $1,500 to $2,000 in real money you're going to be able to get more of from your Social Security than you did before. So we have to look at that, especially since at the end of each year we can make changes. So those are key ways. In addition, we want to take advantage in areas where super competitive. Are there over-the-counter extra benefits we can take advantage of? Are there other things we can save on that are built into the plan? Dental, vision, especially the dental piece if you have a lot of dental work. So let's really dive into the options available to you and see if we can save you money in a lot of different ways with Advantage plans. Thank you for watching the video. Just know you can reach out to us directly regarding your own personal insurance needs. There's no cost for assistance. We don't push, we don't try to sell, we answer questions. And we do it all day long because keep in mind, California health insurance is really unique. Even by geography and area in California, it can differ. And a lot of agents and brokers are in Florida, they're nationwide. They don't really know this state and how health insurance works here. We do. That's all we do all day long. Again, no cost to you. You can call us, you can email us, you can chat. You can even book a time to go through your individual questions, and we will help guide you as best as we can. Check out our Google reviews, and you'll see that we really do try to help people, and that shows throughout the reviews and hopefully through the information we're able to bring you. Also, please like and subscribe. It allows us to keep bringing this information to try to make health insurance easier to understand, and more importantly, to help you save money while finding the best plan for your needs.